With us this hour from Durham, North Carolina, is Dr. Gavin Yamey, Professor of Global Health and Public Policy at Duke University. Dr. Yamey, welcome back.
Thanks for having me back on your show.
OK, well, some vaccine, I guess, is better than no vaccine. This shipment to Ghana will cover about 20% of the population. What happens to the other 80%?
Well, first, can I say it's obviously fantastic news that the first doses from the global vaccine facility COVAX are now shipping and, as you said, have arrived in Ghana. The idea behind this global mechanism is that it should be able to vaccinate 15 to 20% of people in every country, and that should be enough to cover health workers and the highest risk people first. And that's the priority, should be the priority everywhere. It's certainly the priority here in the US. As you know, we're vaccinating health workers and the highest risk people first. Then as the supply expands over the year and into the new year, obviously the facility hopes to be able to vaccinate more and more people. But vaccinating health workers and the highest risk people first everywhere is the right approach.
Absolutely, and there are a lot of countries, though, which are in need and meet the COVAX criteria, and the shipments are arriving in Africa at the same time. There is this new study which says the virus has spread much further than first believed. For example, at least 1 in 5 people in Lagos, Nigeria, could have contracted the coronavirus by October last year. That's an infection rate far higher than one reported through the national surveillance system. So now there is this overwhelming demand for a vaccine, which is in short supply in poorer countries, where the coronavirus is actually much worse than official numbers suggest.
So here is the problem. 3/4 of all the doses of COVID-19 vaccines have gone to just 10 rich countries. Rich nations have been hoarding the supply, and that's got to change. Now, of course, I'm delighted that people in rich countries are getting vaccinated. In Britain, my parents who are at high risk from their age, my sister who's a health worker treating people with COVID-19, they've been vaccinated. That's fantastic. I can sleep, much better at night knowing that they've been protected. But if we continue to hoard in the rich world, it's not just unfair and unjust, it's terrible for global public health, because an outbreak anywhere can become an outbreak everywhere. And as we know from what we've seen in Brazil, in South Africa, in England, when there is uncontrolled viral transmission, you increase the chances of a variant of concern, a variant that may be more transmissible, may even potentially be more deadly. So it makes no sense from a health point of view, from an equity point of view, to hoard doses. And the last thing I will say is it's also terrible economically. One study has shown that in the worst case scenario, the most selfish scenario, if you like, in which rich nations are largely vaccinated by the summer and poor nations are left behind, the global economic loss could be $9 trillion. And get this, half of those costs would be borne by rich nations. Our exports would be down. We wouldn't be able to get machine parts because of supply chain disruption. So here is a situation where your health is my health, your economic well-being is my economic well-being. We're all interconnected, and it's time for us to urgently find solutions so that we get global vaccine herd immunity.
Let's just take a look at the map, because the disparity of vaccine being rolled out across the world is stark when you look at it in terms of this. So if you look at the dark colours here, that's obviously the United States, where the vaccine is being rolled out at great numbers. And then the lighter the colours, then there are places where not one single dose of vaccine has been given to one single person. You talked about the moral argument and the self-interest argument, but how do you get this across to places like the United States, where the Biden administration is boasting about securing more and more supplies of vaccine?
So, look, I am a realist. I understand the politics of this, but I would say what's really interesting is if you look at public polling in rich nations, overwhelmingly, the public wants to see more international cooperation. And a poll in Britain last week found that 60% of the public wants doses to go to low and middle income countries as well. They don't want rich nations to hoard. And so I think that political leaders in rich nations should be really telling the story to their citizens of why it's so important to share. And I think that once you've vaccinated the highest risk people, your health workers, that's when you can start to share. Now, look, Norway is doing it. Norway has said that as it starts vaccinating its own citizens, it will start donating doses at the same time to COVAX. And so, you know, that just shows that it can be done if there's a political will. Other nations have said that they will eventually donate superfluous doses. Britain has said that, but only after they vaccinated everybody, and that's not good enough. You know, places like Britain and the US and Canada have bought enough doses to vaccinate their entire populations 4 or 5 times over. You know, that kind of hoarding is it's immoral.
Gavin, Yami, thank you so much, Jamie, for being with us. We appreciate it, and some very good points there. Something to think about. Thank you, sir.
Thanks, John.